New at 4 in today's Community Focus, as United Medicare Advantage patients tick closer to losing coverage at Brown University Health hospitals, the school is out with a new tool that looks closely at these Medicare plans. David Meyers is with the school's Center for Advancing Health Policy through Research. He joins me now live in studio. Thanks for being here.
Yeah, thank you so much for having me.
So there's this new tool, like I mentioned, that you've helped to create called Medicode. What is the tool exactly?
Yeah, so in the Medicare program, you can get your insurance from traditional Medicare, where the government pays for everything, or Medicare Advantage, where private health insurance companies are paid to take care of patients. These plans are paid more for taking care of sicker people, and so they have a really strong incentive to try and make their enrollees look as sick as possible to increase their payment rates. So the goal of this tool was to try and quantify how much extra are we paying nationally and on a state level for these plans that are sort of helping their patients look sicker than patients are in the traditional Medicare program.
So we're talking about taxpayer dollars here. What is the data showing?
So we find that nationally about $30 billion are spent, paid to these plans for patients appearing sicker than these patients are what might be in the traditional Medicare program. So it's about $30 billion nationally, and in Rhode Island it's about $50 million.
And in terms of breaking down, what insurance providers are doing what, has the data revealed anything about that?
So different companies definitely do this at different rates, and we find that some providers are engaging maybe in this activity more than others. And plans use different tools like health risk assessments, where they send people to your home, which could help connect you with care, but they also do that to try and capture more codes so that they can get paid more in this risk adjustment system.
Why is this data so important? Why did you want to look into this?
So we know that there's a lot of money that's being spent here, $30 billion per year, and we wanted to get a better understanding of how different companies are doing this differently. It's one thing to come up with a policy solution that affects everybody at once, but to really address the problem, it's really important to know what the variation is across the system. And so we wanted to make that data publicly available so that policymakers, people can understand how much is being spent on the system.
And as I mentioned at the top of the conversation, Brown University Health Hospitals and United Healthcare are sort of done negotiating right now. And these Medicare Advantage customers, which is what you're really looking at, are going to lose coverage at the system's hospitals starting July 1st. Strange timing. Does this have anything to do with those negotiations?
So we can't really, this doesn't tell us that much about those negotiations, but this is a time when there's a lot of sort of financial pressures on these plans and a lot of pressure for these plans to find opportunities to sort of make more money in the program. And so this is one of those opportunities for plans to try and boost the payments they get from the government.
And just quickly, before I let you go, I know you said that this issue is being looked at nationally by lawmakers. What do you hope people can use this data for?
Yeah, so I really hope that this data can provide a better understanding so that we can pass new legislation to address some of these issues. Congress is considering all sorts of different budget moves affecting the Medicaid program, affecting the Medicare program, and there might be a lot of opportunity to look at these potential excess payments in the Medicare Advantage program.
And I should mention, I did reach out to United Health before we came on air, haven't immediately heard back, but will of course update with any statement they have. David Meyers with Brown University, thanks so much for being here.
Thank you so much for having me.